When implementing a behavior intervention plan, which of the following is not a necessary step? A. Collecting baseline data before intervention. B. Consistently applying intervention strategies. C. Ignoring the supervising BCBA's instructions. D. Monitoring progress and making adjustments as needed. Answer: C. Ignoring the supervising BCBA's instructions is not acceptable. An RBT should always collaborate with and follow the guidance of their supervising BCBA to ensure ethical and effective implementation of intervention plans. Your client has difficulty transitioning between activities. What antecedent strategy might you use to assist with smoother transitions? A. Provide a verbal countdown before transitions. B. Ignore the client's behavior during transitions. C. Increase the demand during transitions. D. Remove all preferred items before transitions. Answer: A. Providing a verbal countdown is an antecedent strategy that prepares the client for the upcoming change, potentially reducing anxiety and resistance during transitions. When a behavior is followed by the addition of a stimulus that decreases the future frequency of that behavior, this is known as A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: C. Positive punishment involves adding a stimulus after a behavior that decreases the likelihood of the behavior occurring in the future. Which measurement procedure records whether a behavior occurs at the exact moment an interval ends? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency recording. Answer: C. Momentary time sampling records whether the behavior occurs at the exact moment the interval ends, not throughout the entire interval. A child earns a sticker for every 5 math problems completed. This is an example of which schedule of reinforcement? A. Fixed ratio. B. Variable ratio. C. Fixed interval. D. Variable interval. Answer: A. A fixed ratio schedule provides reinforcement after a set number of responses, in this case, after every 5 math problems. Before beginning a session, an RBT should review the client's A. Favorite TV shows. B. Previous session notes and data. C. Family history. D. Personal opinions about the client's behavior. Answer: B. Reviewing previous session notes and data helps the RBT prepare for the session by understanding progress and planning accordingly. What is the primary goal of a functional behavior assessment, FB? A. To diagnose a mental disorder. B. To identify the function of a behavior. C. To create a punishment plan. D. To assess academic skills. Answer: B. An FBA seeks to determine why a behavior is occurring, which informs the development of effective intervention strategies. Which of the following is an example of an unconditioned reinforcer? A. Money. B. Praise. C. Food. D. Tokens. Answer: C. Food is an unconditioned reinforcer because it is naturally reinforcing without prior learning. When teaching a new skill, which prompting strategy involves starting with the least intrusive prompt and increasing as needed? A. Most to least prompting. B. Least to most prompting. C. Time delay prompting. D. Stimulus fading. Answer: B. Least to most prompting begins with minimal assistance and increases support only if the learner needs it. An RBT notices that a client's aggressive behavior increases temporarily when an extinction procedure is first implemented. This phenomenon is known as A. Spontaneous recovery. B. Extinction burst. C. Response generalization. D. Reinforcer devaluation. Answer: B. An extinction burst is a temporary increase in the frequency or intensity of the behavior when reinforcement is initially withheld. Delivering reinforcement after an unpredictable number of responses describes which schedule? A. Fixed ratio. B. Variable ratio. C. Fixed interval. D. Variable interval. Answer, B. A variable ratio schedule provides reinforcement after a varying number of responses, which is unpredictable. In a discrete trial training (DTT) session, the SD stands for A. Discriminative stimulus. B. Stimulus delta. C. Standard deviation. D. Schedule of delivery. Answer, A. The discriminative stimulus, SD, is the instruction or cue that signals the availability of reinforcement for a specific response. When a learner continues to perform a skill over time after formal teaching has ended, this is referred to as A. Generalization. B. Maintenance. C. Adaptation. D. Shaping. Answer, B. Maintenance is the ability to sustain a learned behavior over time without ongoing intervention. If an RBT is graphing the total number of correct responses over time, the data points would be plotted on the A. X-axis representing responses, Y-axis representing time. B. Both axes representing responses. C. Both axes representing time. D. X-axis representing time, Y-axis representing responses. Answer, D. In behavior analysis graphs, time is typically on the x-axis, horizontal, and the behavior, responses, is on the y-axis, vertical. Which of the following is not an example of professional and ethical behavior for an RBT? A. Maintaining client confidentiality. B. Accepting gifts from a client's family. C. Collaborating with supervisors. D. Following the behavior intervention plan. Answer, B. Accepting gifts can create a dual relationship and is considered unethical in professional practice. An RBT is using a prompting hierarchy and starts by giving a full physical prompt. This is an example of A. Least to most prompting. B. Most to least prompting. C. Graduated guidance. D. Stimulus fading. Answer, B. Most to least prompting begins with the most intrusive prompt and systematically reduces assistance as the learner gains independence. The process of reinforcing successive approximations toward a target behavior is known as A. Shaping. B. Chaining. C. Modeling. D. Imitation. Answer, A. Shaping involves reinforcing closer and closer approximations to the desired behavior. During a session, an RBT observes the time between a prompt and the client's response. This measurement is called A. Duration. B. Interresponse time. C. Latency. D. Frequency. Answer, C. Latency is the time elapsed from the presentation of a stimulus, prompt, to the initiation of the response. If a client learns to say hello in therapy and then starts saying hello to people in the community, this is an example of A. Stimulus generalization. B. Response generalization. C. Maintenance. D. Discrimination. Answer, A. Stimulus generalization occurs when a behavior is evoked by stimuli that are similar to the original training stimulus. A functional communication training (FCT) intervention is designed to A. Teach replacement behaviors that serve the same function as the problem behavior. B. Increase academic skills. C. Reduce verbal communication. D. Punish inappropriate behaviors. Answer, A. FCT replaces problematic behaviors with appropriate communication that achieves the same outcome for the client. Which of the following is considered a conditioned reinforcer? A. Food. B. Water. C. Praise. D. Sleep. Answer, C. Praise is a conditioned reinforcer because it acquires its reinforcing properties through association with other reinforcers. When an RBT withholds reinforcement following a behavior that was previously reinforced, this procedure is called A. Punishment, B. Extinction, C. Negative reinforcement, D. Differential reinforcement. Answer, B. Extinction involves discontinuing the reinforcement of a previously reinforced behavior, leading to a decrease in that behavior. An RBT is assisting in a preference assessment where items are presented one at a time and the client's reaction is noted. This type of assessment is called A. Paired choice assessment, B. Multiple stimulus without replacement, C. Single stimulus assessment, D. Free operant assessment. Answer, C. In a single stimulus assessment, items are presented individually to gauge the client's interest. The ethical code that RBTs must follow is outlined by the A. American Psychological Association, APA, B. Behavior Analyst Certification Board, BACB, C. National Association of Social Workers, NASW, D. Association for Behavior Analysis International, ABI. Answer, B. The BACB provides the ethical guidelines and code of conduct for RBTs and other certified professionals. When a client is learning to tie their shoes, the RBT provides a prompt for each step and gradually reduces assistance as the client becomes more proficient. This teaching method is known as A. Forward chaining, B. Backward chaining, C. Total task chaining, D. Shaping. Answer, C. Total task chaining involves teaching all steps of a task analysis during each teaching opportunity, providing prompts as needed and fading them as the client gains independence. An RBT is teaching a client to identify colors. The RBT holds up a red card and says, "What color is this?" This instructional cue is referred to as A. Discriminative stimulus, SD, B. Stimulus delta, S delta, C. Prompt, D. Reinforcer. Answer, A. The SD is a cue or instruction that signals the availability of reinforcement for a specific response. When collecting data on the percentage of correct responses, the RBT is measuring A. Frequency, B. Rate, C. Percentage, D. Duration. Answer, C. Percentage data represents the proportion of correct responses out of the total opportunities, useful for assessing accuracy. A client's behavior increases when a preferred item is given after the behavior occurs. This is an example of A. Positive reinforcement, B. Negative punishment, C. Positive punishment, D. Negative reinforcement. Answer, A. Positive reinforcement involves adding a stimulus after a behavior, increasing the likelihood of the behavior occurring again. Which of the following is an example of a conditioned punisher? A. A loud noise startling a person, B. A verbal reprimand saying no, C. Touching a hot stove and feeling pain, D. Losing access to a favorite toy. Answer, B. A conditioned punisher acquires its punishing properties through association with other punishers. Verbal reprimands are learned to be punishing. The ethical guideline that requires RBTs to maintain competence through ongoing education is referred to as A. Professional integrity, B. Competence, C. Responsibility, D. Respect for rights and dignity. Answer, B. Maintaining competence involves ongoing professional development to provide effective services. An RBT uses a token economy system where the client earns tokens for completing tasks, which can be exchanged for a larger reward. This system utilizes A. Continuous reinforcement, B. Intermittent reinforcement, C. Generalized conditioned reinforcers. D. Unconditioned reinforcers. Answer: C. Tokens are generalized conditioned reinforcers because they can be exchanged for various backup reinforcers. The process of teaching a client to respond appropriately in the presence of specific stimuli and not in the presence of others is called A. Shaping. B. Discrimination training. C. Fading. D. Modeling. Answer: B. Discrimination training involves reinforcing a behavior in the presence of one stimulus, S, D, and not reinforcing it in the presence of another, S delta. A behavior reduction plan should include all of the following except A. Operational definition of the target behavior. B. Antecedent interventions. C. Punishment procedures only. D. Replacement behaviors. Answer: C. A comprehensive behavior reduction plan includes antecedent strategies, replacement behaviors, and consequence interventions, not just punishment. When a client engages in self-stimulatory behavior that produces its own reinforcement, this behavior is maintained by A. Social positive reinforcement. B. Social negative reinforcement. C. Automatic reinforcement. D. Tangible reinforcement. Answer: C. Automatic reinforcement occurs when the behavior itself produces reinforcement without social mediation. An antecedent intervention that involves providing choices to a client to reduce problem behaviors is known as A. High probability request sequence. B. Non-contingent reinforcement. C. Offering choice. D. Demand fading. Answer: C. Offering choices can increase compliance and reduce problem behaviors by giving the client a sense of control. In behavior analysis, the term punishment refers to A. Any consequence that decreases the future frequency of a behavior. B. A negative and harsh disciplinary action. C. Removal of privileges only. D. A timeout procedure. Answer: A. Punishment, in behavior analysis, is a technical term meaning a consequence that reduces the likelihood of a behavior recurring. A behavior that is observable and measurable is referred to as A. Subjective. B. Operationally defined. C. Hypothetical. D. Internal. Answer: B. An operational definition specifies observable and measurable components of a behavior, allowing for consistent data collection. Which of the following is an example of dual relationships that RBTs should avoid? A. Accepting a client's invitation to a family event. B. Providing services only during scheduled sessions. C. Consulting with the supervising BCBA. D. Documenting session notes objectively. Answer: A. Engaging in personal relationships with clients can create conflicts of interest and is considered a dual relationship. The process of gradually removing prompts until the learner can perform the behavior independently is called A. Prompt fading. B. Stimulus control. C. Generalization. D. Modeling. Answer: A. Prompt fading reduces assistance over time to promote independence in performing the target behavior. An RBT is required to renew their certification. A. Every 5 years, including retaking the exam. B. Every 2 years, with no additional requirements. C. Only once after initial certification. D. Every year, including completing the required continuing education and supervision hours. Answer: D. RBTs must renew their certification annually, which includes meeting supervision and continuing education requirements as specified by the BACB. Before starting services, the BCBA conducts observations in the client's natural environment and records data on the antecedents and consequences of behaviors. This is an example of which functional assessment method? A. Indirect assessment. B. Descriptive assessment. C. Functional analysis. D. Experimental assessment. Answer B. Descriptive assessments involve direct observation of behavior in the natural environment without manipulation, recording antecedents and consequences as they occur. Sarah's teacher removes a token from her token board each time she talks out of turn. As a result, Sarah decreases her talking out of turn behavior. This is an example of A. Negative reinforcement. B. Positive punishment. C. Response cost. D. Extinction. Answer C. Response cost is a form of negative punishment where a reinforcer is removed following a behavior, decreasing the likelihood of that behavior occurring in the future. A client's behavior plan specifies the use of a fixed ratio reinforcement schedule, but the client's parents request that reinforcement be given after each correct response instead. As an RBT, what should you do? A. Implement the parent's request immediately. B. Explain to the parents why their suggestion is ineffective. C. Inform the parents that you will discuss their request with the BCBA. D. Ignore the parent's request and follow the plan. Answer C. The RBT should communicate the parent's concerns to the supervising BCBA, who can address the request appropriately. It's important to maintain professional boundaries and follow the established plan unless directed otherwise by the BCBA. A parent asks the RBT for recommendations on alternative therapies for their child, such as special diets or supplements. How should the RBT respond? A. Provide information on popular alternative therapies. B. Refer the parent to the BCBA for further discussion. C. Share personal opinions on the effectiveness of such therapies. D. Recommend consulting a medical professional. Answer B. The RBT should refer the parent to the supervising BCBA, who can provide guidance within their scope of practice or recommend consulting with appropriate professionals. The time between the end of one response and the beginning of the same response is called A. Latency. B. Duration. C. Interresponse time, IRT. D. Frequency. Answer C. IRT measures the time between two successive responses, useful for assessing rates of behavior. Which of the following is a behavior-environment interaction that can be observed and measured? A. A client's verbal response to a question. B. A client's thought about a task. C. A client's feeling of happiness. D. A client's desire to play. Answer A. Observable and measurable behaviors are those that can be seen and recorded, such as verbal responses. An RBT is instructed to use partial interval recording for a client's hand-flapping behavior. This means the RBT will record A. Whether the behavior occurred at any time during each interval. B. Whether the behavior occurred for the entire interval. C. The exact number of times the behavior occurred. D. Whether the behavior occurred at the moment the interval ends. Answer A. Partial interval recording notes if the behavior occurred at any point during the interval, not how many times. A parent tells the RBT that they want to adjust the goals in the client's treatment plan without consulting the BCBA. What should the RBT do? A. Make the changes as requested. B. Explain that changes need to be made by the BCBA. C. Agree to discuss it later. D. Ignore the parent's request. Answer B. The RBT should inform the parent that the BCBA is responsible for making treatment plan adjustments. The principle that interventions should be based on the simplest and least intrusive methods is known as A. Principle of parsimony. B. Informed consent. C. Right to effective treatment. D. Least restrictive alternative. Answer D. The least restrictive alternative principle emphasizes using the most effective but least intrusive interventions. When a behavior is emitted more often in the presence of a particular stimulus condition due to a history of reinforcement, this is called A. Stimulus generalization. B. Stimulus control. C. Response generalization. D. Motivating operation. Answer B. Stimulus control occurs when the presence of an SD increases the likelihood of a behavior due to past reinforcement. If a client's behavior decreases because it no longer results in escape from demands, the extinction procedure used is A. Escape extinction. B. Sensory extinction. C. Attention extinction. D. Tangible extinction. Answer A. Escape extinction involves preventing the behavior from allowing escape, reducing its future occurrence. The RBT notices that a client follows instructions better after a brief break. The RBT starts incorporating short breaks between tasks. This is an example of A. Positive reinforcement. B. Negative reinforcement. C. Antecedent intervention. D. Punishment. Answer C. Modifying the environment before a behavior occurs to increase desired behaviors is an antecedent intervention. Upon arriving for a session, a parent informs you that the client has been engaging in aggressive behavior due to a new medication. They ask for your advice. What is the appropriate response? A. Offer strategies to manage the aggression. B. Suggest they stop the medication immediately. C. Inform them you will contact the BCBA promptly. D. Research the medication and provide recommendations. Answer C. The RBT should acknowledge the concern and inform the parent that they will notify the BCBA, as medication management and associated behaviors are outside the RBT scope of practice. During a session, a client's mother requests that you focus only on academic tasks and stop working on social skills, contrary to the behavior plan. What should you do? A. Comply with the mother's request immediately. B. Explain the importance of social skills training. C. Ignore the request and continue as planned. D. Inform the mother that you will discuss her concerns with the BCBA. Answer D. The RBT should communicate the parent's request to the BCBA, who can adjust the behavior plan if appropriate and ensure that services align with the client's goals. Your BCBA is implementing differential reinforcement of alternative behavior, DRA, to address a client's screaming during tasks. Which replacement behavior is most appropriate to teach? A. Completing tasks quietly. B. Requesting help appropriately. C. Taking a break without permission. D. Ignoring the task. Answer B. DRA involves reinforcing an alternative behavior that serves the same function as the problem behavior. Teaching the client to request help appropriately addresses the issue. A student frequently leaves their seat during class. The teacher decides to reinforce the student for staying seated during instructional time. Which differential reinforcement procedure is being used? A. Differential reinforcement of incompatible behavior, DRI. B. Differential reinforcement of low rates, DRL. C. Differential reinforcement of other behavior, DRO. D. Differential reinforcement of high rates, DRH. Answer A. DRI reinforces a behavior that is incompatible with the problem behavior. In this case, staying seated is incompatible with leaving the seat. A client tells inappropriate jokes to peers and receives laughter and attention in return, increasing the behavior. What is the likely function of this behavior? A. Sensory stimulation. B. Escape. C. Attention. D. Access to tangibles. Answer C. The client's behavior is maintained by the attention received from peers, as evidenced by the increase in behavior following laughter. A motivating operation that decreases the effectiveness of a reinforcer is called A. Establishing operation. B. Abolishing operation. C. Discriminative stimulus. D. Conditioned reinforcer. Answer B. An abolishing operation decreases the reinforcing effectiveness of a stimulus, making the behavior less likely to occur. A therapist reinforces a child's polite requests for attention and ignores shouting. This is an example of A. Differential reinforcement, B. Extinction, C. Shaping, D. Punishment. Answer A. Differential reinforcement involves reinforcing a desirable behavior, polite requests, while withholding reinforcement for an undesirable behavior, shouting. You observe that a client often tries to avoid homework by complaining of headaches, and the teacher allows them to skip assignments. What is the likely function of the client's behavior? A. Access to tangibles, B. Escape, C. Sensory stimulation, D. Attention. Answer B. The client's behavior results in avoiding an unpleasant task, homework, indicating an escape function. The four main functions of behavior recognized in applied behavior analysis are A. Tangible, automatic, escape, attention, B. Sensory, emotional, physical, social, C. Access, avoidance, sensory, control, D. Attention, avoidance, access, sensory. Answer A. The four main functions are access to tangibles, automatic reinforcement, sensory, escape, and attention. A child learns to label a red apple as apple and then calls a red ball apple. This is an example of A. Stimulus generalization, B. Response generalization, C. Overgeneralization, D. Discrimination. Answer C. Overgeneralization occurs when a response is applied too broadly to stimuli that are similar but not identical to the training examples. A client is taught to request "help please" when needing assistance. Later, the client begins to say "assist me" and "I need help," which were not explicitly taught. This demonstrates A. Stimulus generalization, B. Response generalization, C. Maintenance, D. Prompt dependency. Answer B. Response generalization occurs when a client uses untrained responses that serve the same function as the trained behavior. A client calls all men daddy after learning to identify their own father as daddy. This is an example of A. Stimulus discrimination, B. Stimulus generalization, C. Overgeneralization, D. Response generalization. Answer C. The client is overgeneralizing the term daddy to all men, not discriminating between their father and other males. When a client continues to use a learned skill over time without reinforcement, this is referred to as A. Generalization, B. Maintenance, C. Acquisition, D. Shaping. Answer B. Maintenance is the continued use of a skill after instruction has ended and reinforcement has been faded. During a session, the RBT notices an increase in a client's challenging behavior after introducing a new teaching strategy. What should the RBT do? A. Continue with the strategy to see if behavior decreases. B. Punish the challenging behavior. C. Report the observation to the supervising BCBA. D. Ignore the behavior and proceed. Answer C. The RBT should communicate any significant changes or concerns to the BCBA for guidance and potential adjustments to the intervention. A client's parent insists that you use a specific intervention that is not evidence-based and contradicts the behavior plan. How should you handle this situation? A. Implement the parent's requested intervention. B. Explain that you must follow the evidence-based plan and inform the BCBA. C. Debate the parent on the effectiveness of interventions. D. Ignore the parent's request and proceed as usual. Answer B. The RBT should professionally explain the necessity of following the established plan and report the parent's request to the BCBA for further discussion. If an RBT suspects that a client is being neglected at home, they are ethically obligated to A. Discuss their concerns with the client's parents. B. Report their suspicions to the appropriate authorities and inform the BCBA. C. Ignore the situation to avoid conflict. D. Conduct an independent investigation. Answer B. Mandated reporters are required to report suspicions of abuse or neglect to authorities and inform their supervisor, following legal and ethical guidelines. A behavior that looks different but serves the same function as the target behavior is an example of A. Response generalization. B. Stimulus generalization. C. Overgeneralization. D. Behavioral contrast. Answer A. Response generalization occurs when different behaviors produce the same outcome or function. In a fixed interval schedule, reinforcement is delivered A. After a fixed number of responses. B. After a variable number of responses. C. For the first response after a fixed amount of time. D. For the first response after a variable amount of time. Answer C. Fixed interval schedules provide reinforcement for the first response after a set period. When an RBT uses gestures or pointing to prompt a correct response, this is known as A. Verbal prompt. B. Physical prompt. C. Gestural prompt. D. Modal prompt. Answer C. Gestural prompts involve using physical movements, like pointing, to guide the client. A client's challenging behavior increases temporarily after reinforcement is withheld. This phenomenon is called A. Extinction burst. B. Spontaneous recovery. C. Resurgence. D. Habituation. Answer A. An extinction burst is a temporary increase in the frequency or intensity of a behavior when reinforcement is first removed. The confidentiality of client information is protected under which ethical principle? A. Beneficence. B. Non-maleficence. C. Privacy and confidentiality. D. Integrity. Answer C. Privacy and confidentiality require professionals to protect personal information and disclose it only with consent or as required by law. An RBT observes a colleague engaging in unethical behavior with a client. What is the appropriate first step? A. Confront the colleague aggressively. B. Report the behavior to the supervising BCBA. C. Ignore the behavior to avoid conflict. D. Discuss the concern with another coworker. Answer B. Ethical guidelines require reporting unethical conduct to appropriate authorities, starting with the supervisor. When an RBT is asked to perform tasks outside of their competence, they should A. Attempt the tasks to the best of their ability. B. Accept the tasks to please their supervisor. C. Decline and explain they are outside their scope of practice. D. Delegate the tasks to another RBT. Answer C. RBTs should provide services only within their competence and refer tasks beyond their scope to qualified professionals. A behavior intervention plan includes a section on antecedent interventions. Which of the following is an example of an antecedent intervention? A. Providing choices to the client before a task. B. Delivering praise after task completion. C. Implementing timeout following problem behavior. D. Ignoring attention-seeking behaviors. Answer A. Antecedent interventions are strategies implemented before a behavior occurs to prevent or reduce the likelihood of problem behaviors. A client has difficulty starting assignments independently. The RBT provides a prompt immediately after giving the instruction, which is gradually delayed over time. This technique is called A. Stimulus fading. B. Graduated guidance. C. Least to most prompting. D. Time delay prompting. Answer D. Time delay prompting involves increasing the interval between the instruction and the prompt to encourage independent responses. Which of the following is an example of an unconditioned reinforcer? A. Praise. B. Stickers. C. Food. D. Tokens. Answer, C. Unconditioned reinforcers are naturally reinforcing without prior learning, such as food, water, and warmth. An RBT is graphing data collected during sessions. The vertical axis, y-axis, typically represents A. Time or sessions. B. The independent variable. C. The behavior or response measured. D. The phase change line. Answer, C. The y-axis represents the dependent variable, which is the behavior being measured, e.g., frequency, duration. Which of the following is not an appropriate action for an RBT when receiving feedback from a supervisor? A. Actively listening to the feedback. B. Implementing suggested changes. C. Defending their actions and ignoring the feedback. D. Asking questions for clarification. Answer, C. RBTs should be receptive to feedback, implement changes, and seek clarification, not become defensive or dismissive. A client begins to engage in self-injurious behavior, SIB, during a session. What is the first priority for the RBT? A. Collect data on the behavior. B. Ensure the client's safety. C. Call the client's parents. D. End the session immediately. Answer, B. The RBT's first priority is the safety and well-being of the client, implementing any necessary procedures to prevent harm. In a multiple stimulus without replacement, MSWO, preference assessment, items are A. Presented one at a time. B. Presented in pairs. C. Presented in an array and removed once selected. D. Available freely without any prompts. Answer, C. In MSWO, multiple items are presented simultaneously, and items chosen are not replaced in subsequent trials. Which of the following scenarios represents a breach of client confidentiality? A. Discussing client progress with the supervising BCBA. B. Sharing client information with another RBT not on the case. C. Reporting abuse to authorities. D. Documenting session notes in the client's file. Answer, B. Confidential information should only be shared with individuals directly involved in the client's care or as required by law. An RBT is required to collect inter-observer agreement, IOA, data periodically. This practice is important because it A. Ensures consistency and reliability of data. B. Increases the client's motivation. C. Reduces the need for supervision. D. Simplifies data collection procedures. Answer, A. IOA checks help verify that data collected are accurate and consistent between observers. When a client's challenging behavior no longer produces the desired reinforcement, leading to a decrease in that behavior, this is known as A. Punishment. B. Extinction. C. Negative reinforcement. D. Differential reinforcement. Answer, B. Extinction involves discontinuing the reinforcement that previously maintained a behavior, resulting in its decrease over time.